one supports them, least of all the husbands. But with the program, if you see, from 1.2% of husbands supporting them, after the program 24.3%. So these are all the typical parameters that you do in traditional reporting. So you report the behavior or the outcome or the output before the program, and then you measure the outcome after the program. Let us see how SROI, or social return on investment, reports the impact. Social return on investment reports the impact. In addition to whatever has happened, it also reports what had been the value of the intervention in terms of costs, in terms of expenses, and what has been the value of the outcomes or the impact. So let's say I'm taking an example for SROI of setting up or providing a community water plant in the village which had been suffering because of the lack of drinking water. So imagine a village which didn't have any drinking water available. The only option for them was either to consume contaminated, unfiltered, fluoride infested groundwater for their consumption, or buy at exorbitant prices purified drinking water from private water purifiers. These were the only two options. And then there was a water plant which was installed in the village, and it was able to provide drinkable or it was able to provide drinking water at a very affordable cost. Now, if we see what is the total value of the project and what is the total value of the impact that this program created, we are able to calculate in the last column the ratio, which is nothing but which is the SROI value, which can be interpreted as that a 1 rupee or a 1 unit of investment or expenses in this program generated 75.12 units of social value. So if you go back to the previous slide, let's say this, if I compare the first, second, or third, or any of these indicators, let's say I compare this women involved in decisions at home. So this 22.4 and 75.7, if we are somehow able to attach monetary value to these outcomes, we will get the SROI. Imagine if I say that, okay, to achieve 75.7% of this particular outcome, I spent, let's say, X number of rupees. Correct? We will have to do the program, we will have to change the behavior, we will have to raise the awareness, we will conduct meetings, we will conduct campaigns, we will conduct trainings. So all of that involves money. All of that program, all of those interventions, all of those activities will ensure that, okay, now 75.7% women are now involved in decision making. But have we thought about what is the financial value or what is the monetary value of this women empowerment? Yes, it is good that women are now taking or now involving decision making, but why is it needed? Are decision makings now leading to better decisions because of the women involvement? If yes, then better decision means either the decisions are becoming more productive, either either the household is saving more, spending less, earning more. So there has to be some impact. There has to be monetary impact. There has to be the calculation or value of what has been the outcome. So this is what the SROI does. In addition to whatever has been traditionally reported, whatever has been traditionally measured, SROI intends to add monetary value to all the outcomes. So if I see all the impact measurement tools that are normally used in measuring and assessing the impact, they all follow certain activities. They all are pretty similar. But SROI is the only one which talks about comparison of like to like. So SROI says that, okay, this is the social return on investment, means that whatever interventions you have done and whatever outcomes have happened, both positive and negative, this is the sum total of those outcomes. So it gives you a number which can be compared across projects. Let me give you another example. Let's say any one of you or all of you, I don't know the profile of the participants here, but let's assume that you all have at some point in time dealt with a impact program. So either as a donor or as an implementing agency, or as a student, or as someone who is a keen observer of development ecosystem. You must have been familiar with some terminology, for example, program, implementation, budget, and then results and outputs and outcomes and impact. Let's say, assume for some time that you are a CSR and you have been given, or you are heading a CSR team, or you are part of the CSR team in one of the bigger organizations, and you have been given a task to identify and implement a good quality CSR program. Now, first of all, how do you define the good quality CSR programs? Let's say you find out some indicators, you do some research, and then you identify, okay, this is the definition of good quality CSR programs. So you have implemented the program, or you are implementing, you're having some ideas, you want to explore some ideas, and then you're going about discussing, identifying, brainstorming, and whatever. How do you choose? Let's say I come to you with a proposal to do a women empowerment program. So I give you an idea, I give you a proposal that in these districts, 5 districts, this is the situation of women. They're not able to participate in any decision making. The region is really backward, and therefore you should do this program because this will add so much to your CSR. This is one program that you have. Then my colleague from Bala Vikasa, Vijay, he comes to you and he proposes, no, let us not do this women empowerment. It can wait because there's an urgency. We need to educate children first. And his point is also valid. He says that if we give proper education to children, then the women empowerment will automatically happen. That's also correct. I come back to you again. I say, no, if women empowerment happens, then they will be able to send their children to schools. So let us first work on women empowerment so that school program is a success. Then third person comes and he or she proposes to you, now let us not do anything. Let us work on de-addiction of alcoholics in village. Because it is very important for us to de-addict the alcohol. The alcoholism is rampant amongst the male in those districts, and therefore they're not allowing anyone, let alone women empowerment and child or children education, they are not allowing anything. So unless and until we stop that, we will neither be able to do a women empowerment, nor we will be able to do an education program. So now you as a CSR donor, or as a funder, or as an NGO who wants to do something, you are now in a total flux. What to do, how to choose, how to decide on the importance of the intervention, whether education is important, whether women empowerment is important, or whether de-addiction And then there are a whole lot of other issues as well which keep coming up. Nutrition is an issue, care for pregnant ladies is an issue, health services are not up to the mark, there is no hospitalization, there's no hospital, there's no vaccination, there's a lot of complications. So how do you decide? Usually the decision making happens, traditionally the decision making has happened on the basis of the donors or the funders comfort level, or the cause to which he or she is attached to. So if as a person, as a donor, I feel more strongly for women empowerment, then I'll go for that. If I am more passionate about education and primary school education or secondary school education, then I'll fund the education project. So the point that I'm trying to make is that there's no objective method which will give you as a CSR donor or CSR program manager or a funder an idea on what is needed most, given that funds will always be limited. The programs have to be prioritized. Everything cannot be done at one time. So if we are faced with this kind of dilemma, if this kind of confusion, then SROI is a very powerful tool. Very simple. It gives you answer in a very simple manner. Yes, it will require a little bit of time and effort to do, but it will give you an answer. So what needs to be done in this case is you need to calculate what is the total funds or total donation that goes into the each program. Let's say we decided that the total donation is X amount of dollars or X amount of rupees. Let's say 10 lakh rupees or 1 crore rupees or whatever the funding amount is. Now, in that 1 crore rupee, each type of program will give you different impact. So in 1 crore, probably a women empowerment program will give you certain outcomes. The child education, the school education program will give you certain outcomes. The de-addiction program will give you certain outcomes. Immunization and healthcare program will give you certain outcomes. You take all of those outcomes and independently measure what is the social value of those outcomes. Let's say the women empowerment program gives you a social value of 5, just like this. If you see this last column, the social value, so total input value of the program and total impact value, and later on we'll see how to calculate the impact value, but for the time being, just assume that there is a way to calculate impact value of all types of programs. So now you have the total input value, because that's the fund that, or that's the donation that will be given, and you calculate the impact value of all kinds of programs. So women empowerment program, let's say the impact value is 5 crores. Child education program, the impact value is 10 crores. De-addiction program, the impact value is 3 crores. And healthcare program, the impact value is 25 crores. So now you would have a mechanism to identify and shortlist the program. So now you can say, no, the healthcare program is giving me the highest social value. Social value, if we calculate properly according to the methodology that we will see in the later part of the presentation today, will give you the quality and quantum of the impact. So higher the social value, meaning higher the impact. So if we are able to convert the value of this impact into monetary unit, we will be able to compare the impact of all kinds of programs, and then it will be easier for us to choose a particular program. This is the important concept that I want you all to completely understand. And if you have any questions around it, please note them down. And in the end, at around 4 o'clock, when we are towards the closing of the session, we will handle that question. Yeah. So SROI gives you an edge over the traditional impact measurement methods. It does not completely replaces any of those methods, because in the end the tools will still be the same. You will still need to do surveys, you will still need to do the basic impact measurement, but SROI adds monetary value, and therefore it gives you a very clear cut, a very objective way to measure the utility, or to measure the benefits, to measure the impact of the interventions, be it CSR, be it donor, be it an NGO, be it a corporate team which wants to impact, which wants to understand the impact of their programs, or be it the government wanting to measure the impact of their schemes. SROI is applicable and completely proper for all of these activities. Just like one parameter, which is the profitability, which gives an idea of how well a particular business is doing, SROI gives an idea of how well a particular program is doing in creating impact. Yeah. So if we go to a basic definition, what is the social return on investment? If you all are aware of return on investment, then social return on investment is easy to understand. If you're not clear on return on investment, I'll give you a simple example. Everyone knows about the bank. Everyone knows about the fixed deposits in the bank. Fixed deposits in the bank give you some percentage, some interest. So if you have put your money in the bank, then the interest that you are getting from the bank is your return on investment. If you put 100 rupees in the bank and banks gives you an interest of 10%, that means that at the end of 1 year, you would have earned 10 rupees on that 100 rupees. So your total money would become 110. Correct? So this is your return. So 10 rupees on your 100 is your return on investment. You invested 100 rupees, you got a profit, or you got extra of 10 on 100. So 10 is your return. If you invest in shares, so those 100 rupees, you might get a return of 50. So your money at the end of 1 year, your 100 rupees at the end of 1 year, if invested in particular share, might give you 150 in total. So 100 is your investment, 50 is your return, and you get total of 150. So similarly, this is how the social return is calculated or conceptualized. You put in 1 CR of program funding, or you donate 1 CR of money to create an impact in a particular area. The amount of impact that has been done over the years is your social return. So let's say if the impact is 5 crores, then your social return on investment would be 5:1. If the impact is 2 crores, then it is 2:1. It's as that simple. So a way of accounting the value. Now, as I'm telling you, it's not mandatory to convert all the impact into monetary or into the financial value. But financial value or the monetary value is something which is objective and which can be compared across different programs. Otherwise, we always end up having the discussion whether program A is more impactful or program B is more impactful. SROI gives you that answer in an instant. Measure the impact, measure the SROI, and higher the SROI, better the program. Otherwise, it's a never-ending debate. I will stick to my areas of impact. You will stick to your areas of impact. We might go to the court. We might file a case on each other, and then court will also be not able to decide. Especially when in India, the issues are complex and they're often interrelated. They're often they're often linked to each other. So therefore, social return on investment gives you an objective value of how to calculate the benefits. So it is expressed as a ratio of social benefits versus the costs involved to attain those benefits. It's important. What are the costs? The costs are the intervention costs. If you're working, if any organization has donated money to enhance the gender equality, then that is the input cost or the cost of the program. So those are the costs that we need to take, and it is calculated as quantified benefits because we are taking costs in rupees or in currency. Therefore, the benefit should also be measured in currency. We all take the budgets, we do the activities. This is the budget for, let's say, this is the budget for CSR. This is the budget for this program. This is the budget. That budget is based on the activities. And budget is the most important element in all of these. Everyone discusses budget. I'm not saying that people don't discuss the activities. Yes, activities are important. But in the end, budget is also equally, if not more important. So if we are measuring the inputs in terms of the currency, in terms of the budget, why shouldn't we value the benefits also in the same currency? In the previous example that I showed, if we are measuring the outcome as an improved participation of women in decision making, then I should also measure the benefit of that intervention. Why are we spending so much money? Is it improving? Is it benefiting? If yes, then benefit has to be monetized. If we are measuring the cost in currency, why can't we measure the benefits also in currency? And then again, the traditional or the way it is done is that, okay, it is calculated as a ratio. If you see 9:1, means that for every 1 rupee or 1 unit of currency that has been spent on this intervention, on this program, the benefits have accrued are the benefits that have accrued are worth 9 unit of that currency. Yeah. And then simple, the net present value of outcomes, the net present value of investment. Don't get worried about the net present value. It's a financial term. It's not big, this thing, a very simple way to calculate, but imagine it is nothing but total value of outcomes and total value of investments. So we have done some discussions. Just to summarize, so SROI is purely quantitative. It gives you the currency equivalent of benefits that have accrued. We are not saying that when you write or when you do SROI, you're going to report only one number. No, it's not like that. It's not only one number that will be reported. Later on, we'll see that all the outcomes that are traditionally reported, they all will be reported. We will still report, okay, 43% improvement in women taking decisions, or 50% improvement in spouses helping the pregnant women, or 70% improvement in teacher attending the class and then being there for all. We will still report that. But in addition, we'll conclude the report by giving the value of all those improvement, of all those outcomes. Yeah, it's a standardized comparable result. As I was discussing, you can measure it, you can compare it across all all types of programs. It's holistic. It includes both negative and positive outcomes. See, any change that you are anyone is trying to do in this society will never be a zero-sum game. Any change that will happen, any positive change that will happen, will impact a particular section of the society in a negative manner. Because whatever you are trying to change, that has been existing in the society for some time now. Let's talk about de-addiction. So if you are doing the de-addiction for males in particular village, then indirectly, if you succeed, then you are basically taking away the livelihood of a liquor supplier in that village. If you improve the health of population in the village, then you are in a way taking away the livelihood of the doctors in the community, the medical or the medicine suppliers in the community. So any change, any positive change that is happening in the society, there are parts of the same society which are getting negatively impacted. This is very important to note. In traditional methods, we don't usually report the negative impact. So that's why we always say that this is holistic in nature. It measures who and how people are also getting negatively impacted. Can be used for both evaluation and forecasting. As I was telling you, if you are in a situation where you have to decide which project or which program to fund, you can do an evaluative or forecast. You can do a forecast SROI calculation that this program will give this much of benefit, and this program B will give this much of benefit, and then you can compare and then you can choose a program. Or you can go for the evaluative SROI, which is you do the SROI evaluation after the program has been completed. So you conduct the survey, you measure the benefits, you measure the impact, and then you calculate how much this program has resulted. Inputs and outcomes is directly traceable, robust, and results can be reproduced. Once you have the format, once you have the data, it's pretty simple after that. You can prepare a business case, you can put out in the report, you can even publicize. You can even publicize to your stakeholders that you are creating a value for all the society in terms of creating the projects or supporting the programs which are very, very impactful. Easy to communicate because you can compare the SROI value across different programs. As a CSR also, or as an NGO, or as a government organization, or as government department, or as philanthropic organization, international development organization, you can compare your programs, similar programs across different geographies. So let's say if an organization is supporting women empowerment programs across different states in India, so that organization can easily compare the impact or the social value of the same program in different geographies. Or if an organization is funding funding predominantly in one location but different kinds of programs, then the organization can compare the different programs as to which program is generating what kind of value. And if some of the programs are not generating enough, then it means that that program can be fine-tuned. If the impact is less, the benefits are less, then the reasons can be identified. Maybe the program has outlived its utility. It's not returning anything better now. So maybe there is a need to change the program. So what I'm trying to tell you here is that SROI is an improved or a better way and a more objective way to assess and report the impact, because it offers so many things. Traditional impact assessment could be both qualitative and quantitative. So as we saw in our previous examples, we can report in whatever way we like. The only issue that is there in non-traditional methods is that it's very difficult to compare. We will end up fighting for sure, whether your project is good or my project is good. Your program is good or my program is good, which has bigger impact, and therefore which should be continued. The traditional impact assessment measures, because they are so because they are evolved differently, they are always focus on positive outcomes. I have so far not seen a report which talks about the negative impacts of any program. That's a different debate whether those negative impacts need to be like that. But what I'm trying to say, that in the society, all are stakeholders. Any impact which is positive for, let's say, majority of people, at least the same impact will be negative for minority of or maybe a lesser number of people in the society. That's the rule. Someone will be getting impacted. Yeah. So if you see the result chain, then it starts from the inputs, activities, then outputs, outcomes, and impact. The very typical and very traditional approach. So if we are only measuring inputs, activities, outputs, outcomes, and impact, we're talking about something called RBM, or results based management. If we take problem also, we're talking about theory of change. And if we take the value also with everything else, we are talking about SROI. So SROI, as I am maintaining, is not something very new, is not completely very different, is not out of the world. It's just addition of one more step, which happens to add a lot of value to the whole impact assessment exercise. And therefore, it's not always advisable because it consumes a lot of time and resources. If you see this graph, because it builds on existing models, it means that it's an add-on. So the costs are more, the time is more, and the resource requirement is more. Now, let us just quickly go through. Vijay, how much time do we have?
Rahul, I think by 4:15, if you
Okay,
can
no,
start Q&A. Yeah.
I'm not able to see the time.
It's
somehow.
3:56.
Oh, so we have 10-15 more minutes.
Yeah,
Yeah,
15, yeah,
okay.
17 minutes.
Okay, no worries. So these are the 6 steps that are used to implement and that are used to measure or report or understand SROI. So the first and foremost step is to establish the scope. Who are we estimating this SROI for? Who are the stakeholders? How important are those stakeholders? Not every outcome should be mapped, not every outcome should be quantified, and not every outcome should be monetized. I'm not saying that you neglect the negative outcomes. No, I'm saying that even if there are positive outcomes, they have to be prioritized. Why they have to be prioritized? Because this is an intensive exercise. We don't want to waste our time and efforts on something which is not of great value. So we'll focus only on important indicators, important outcomes, important outputs, important stakeholders, important. So very important to identify what is important in first place. And you establish the scope. Then we start mapping the outcomes. We saw how we had reported the outcomes in those examples. So I'll give you an example of, let's say, my favorite water plant. So what are the outcomes of having a water plant in the village? So the first outcome is people have access to clean drinking water. Second outcome is people are not falling sick as frequently as they were falling sick before the water plant or before they had access to pure water. If people are not falling sick as much as they were earlier, that means they are more available for work. So number of working days have increased. This is the third outcome. Number of working days have increased. The impact of increased working days is that their income levels have become better. So people are earning more. This is the fourth outcome. People are earning more. That means that children are not going to the work anymore, and therefore they are going to schools. Although we are not measuring the impact of education, no, but this is one of the outcomes, an important outcome. What are some of the negative outcomes? Some of the negative outcome that we saw in the villages were that in earlier where there were 3 to 4 rural medical practitioners in the village, now there is only one. So 3 doctors or RMPs, they had to shut their shop. This is the negative outcome. They are part of the same society. So if there's an increase in the income of normal villagers, there is a decrease in the income of doctors in the village. And for them, this is very important. They are as much part of the society as others are. So once we map all the important outcomes, then we say, okay, what is the indicator? So how do we now measure the outcome? So let's say doctor's income has reduced. So how much has it reduced? For how many doctors? And for how many years? See, another important element in SROI is the time period. So for what time period you are evaluating this return? It could be forever. It could be for the duration of the program. It again depends on step number 1, where you establish the scope. Are you measuring the SROI over the program period? If the program has resulted in permanent changes, then will you take those permanent changes to be appearing forever and then keep on calculating the value? Or would you take those permanent changes as final and then just take that time period that in 5 years this permanent changes, and therefore we will estimate only for 5 years? So that's again depends on the scope, the objective, and the intention behind conducting or doing this exercise. So anyhow, so evidencing outcomes and giving them the value. So when we say evidencing outcomes, what is the evidence of this outcome? If I am saying that my water plant has increased the income of villagers, then is there an evidence for that? If yes, then what is that evidence? And basis that evidence, what is the enhancement in the income? So everyone is now earning 20,000 rupees more. So this is how we assign value to all the outcomes. Each and every outcome that we are assessing needs to be assigned a monetary value. What is the value of that outcome? If we are saying that the doctor's expenses or the expenses of villagers related to sickness and illness have decreased, we should be able to estimate conclusively and accurately how many or how much or what is the quantum of those decreased expenses. If we are saying that villagers are now able to work more, then we should be able to calculate how many days more are they working in an year. And if they are working, let's say 10 days or 10 more days in the year, then what is the monetary impact of that? So they are earning wages for 10 more days. And if someone is earning 500 rupees a day, that means their net addition to their revenue or their income is 500 into number of extra days they are able to work. because they are not falling sick. So this is how we calculate and we estimate the impact, or we assign or we estimate the monetary value of the outcomes. It is quite possible that not all outcomes will have very clear cut or very identifiable financial value. And I'll give you an example: training of women or women empowerment. How do you say that after 1 year of program or undergoing training in women empowerment program, the women are more empowered? How do you estimate that? And let's say, even if you say that yes, they are more empowered, they are making better decisions, they are taking up causes which are relevant to them, they are becoming more aware of their rights, and they are facing domestic violence or any other issue or any other discrimination with a lot more confidence. Those are all indicators of women empowerment. But what is the monetary value of that? What is the financial value of a female taking decisions in her household? What is the financial value of she being able to stand up to the rubbish of her household? She is now powerful, she can stand up to whatever nonsense is going on in the household against her. So there is an impact, but how do you find out financial value of that? So those are some areas where there are some standardizations that have happened. Then there are experts like us, who then, depending on the situation, depending on the case, depending on the area, location, program, baseline, and so many other factors, where we identify the financial proxies. They may not be directly related, they may not be direct, because these are the social, or these are the outcomes which do not have a very direct financial proxy, like a water plant or like a health program has. But there are certain indicators. For example, for education. So for education, there is a direct correlation between the enhancement or the increase in literacy rate and its impact on the country's GDP. So every addition or every incremental enhancement in society's literacy rate adds so many percentage of points to the country's GDP. So whenever we are estimating the impact of any education or any literacy program, this is the financial proxy we use. So we use that, okay, if the program intervention has enhanced the literacy of this particular area by 5%, then this is the monetary value of that enhanced literacy. So every outcome will, sooner or later, you will be able to figure out what is the financial proxy. So once you have the financial proxy, then you calculate and then you estimate how long will this financial proxy be applicable. So here comes the timeline. When you say establishing impact, so you estimate that this year, this is the financial benefit. Next year, these are the financial benefits. Next year, these are the financial benefits. If it's a multi-year program, if it's a single year program or a single project, you estimate in 1 year or in that time period, what are the intended benefits and for how long, or what kind of benefits are permanent in nature, so that they will accrue every year. For example, health is not something which is permanent in nature, in the sense that once, let's say, if you don't fall sick in this year, that doesn't mean that you will never fall sick. It's not permanent. You still need to follow all the safety measures and still need to drink the safe water to stay healthy. So some outcomes will be time bound, some outcomes will be permanent, and some outcomes will be perpetual. So that is important to identify, and therefore you calculate the benefit of those outcomes according to the timeline, according to the applicability. And once you have the timeline, you can calculate the SROI. And once you calculate the SROI, you can calculate the ratio. Yeah. So this is in a nutshell the SROI. What I have tried to do today is not give you a very complicated picture of SROI. In reality, this is a little complicated to implement, but once you have understood the basics around it, I think it's a very, very simple tool. It's a very powerful tool. It's a very objective tool, and it is getting gradually very popular amongst the donors, amongst the program managers. And some of the bigger organizations are using this tool to decide on their investments. They're using it to decide where to invest, what kind of projects to choose, and they're also using it to assess the projects. So they have number of programs running, they have funded number of programs. So they use these SROI tools and techniques to measure how their programs are functioning. Yeah. Vijay, how are we doing on time?
We have about 5 minutes, Rahul.
Okay, I think in 5 minutes I'll just want to take the questions and any.
I mean, I'm 5 minutes is for your session to finish, so we'll have another 10 minutes for Q&A.
Oh, okay, okay, okay. Okay, so I think other than that, I think yeah, these are the steps in detail. So as I was telling, very important. I'll just go through them again. Very important to establish the scope, and very important to identify the stakeholders. And when I say stakeholders and scope, what I mean is that be very clear why is it being measured and who all are the or what are the important stakeholders. If it's a program on women empowerment, then women are obviously the most important stakeholders, but their families are also important stakeholders. Yeah, I don't want to sound sexist or anything, but any change in the way women are taking up both household and outside work will or might have an implication on their social or their fabric within the family. Because as I was mentioning earlier, women have this dual responsibility traditionally and also in terms of expectations to take care of their families. It seems natural. Whether it is or not is not a question here, or whether I feel otherwise or you feel otherwise is not a question. But we are dealing with the stakeholders who feel this is very important. So therefore, when the stakeholders feel it is important, it automatically becomes important for the assessment. Then again, the outcomes. Very important to map the outcomes. You should map all the outcomes, because then only it will be clear whether all of them are worth doing the assessment. There'll be all kinds of outcomes. There'll be important outcomes, there'll be minor outcomes, there'll be major outcomes, there'll be less powerful outcomes, there'll be some side outcomes, there'll be all kinds of categories of outcomes. So you map all the outcomes, but not every outcome will be equally important. Then third step would be, once you have all the outcomes, you see what are the evidence of those outcomes and how do you value those outcomes. If there is no direct value possible, then there is an indirect way to assign or assess the value and arrive at the value. Then you establish the impact. There are few technical terms such as dead weight, displacement, attribution, drop off. These are all when you go to the impact assessment, when you do the impact calculation, these all become important. So for example, dead weight. Dead weight means that, let's say you are working on a literacy program. So your intervention has resulted in improved awareness on literacy. And because of your efforts, there is increased enrollment of students in these schools. However, because of the right to education and because of the other important government schemes, there are already a lot of focus on education. So it is quite possible that your program is getting supported by whatever is happening in the larger environment. So if there is any of such thing happening, or your program or your intervention or a particular intervention or particular program is getting indirect support from larger environmental changes or larger societal changes, then that needs to be adjusted, because that's not entirely, or all the impact that you have seen is not entirely out of the own program. So let's say there is an enhancement or there is an increase in enrollment by 30% over the year, 1 year of your program. It is quite possible that even if your program was not there, the increase in enrollment could have been anyways 10-12%, because that's the change in the entire outside environment or the larger environment. So you adjust that 10-12% from your social return, because that is coming from somewhere else. So this is dead weight and attribution. Similarly, drop off. So maybe, when the program is happening, everyone is enthusiastic and participatory, but once the program ends, then how much of that impact will be dropped? So will participants not be there, all of them? Will there be a drop in participation? So all of those calculations, but these are not that important. These are really technical in nature. So you should know that. Then you calculate the SROI. So you calculate all the impact. Whatever is permanent, you project it into the future, because benefits will come in future. Then you calculate the total benefits, the total cost, and then you calculate the ratio, and then you report it. There's something called assurance. So assurance is nothing but, let's say if you have done or I have done the program and I'm doing the reporting, then if a third party also verifies that report, then it's a kind of assurance. Because if it is my program, I have inherent interest to report all the good things about the program. So an independent third party will moderate that kind of interest. So it is expected that an assurance will give a clear picture without any biases. Yeah, and then you report it. So in report, this is all is very important. So you very specifically identify all the 6 steps, and then assurance or verification if possible. So now to sum it up, you see that SROI is not completely out of this world, or not completely different or very different from the traditional reporting methods. If you see in point number 2, outcomes and evidences and impact, you are still doing the traditional way of reporting, where you'll report how many outcomes have happened, what kind of outcomes have happened, what is the number of those outcomes, and all of these things which we saw, it will be still be done. But in addition, the monetary value will be added. So this is the addition, or this is the beauty of SROI, that with a little extra effort, with a little extra detail, with little extra calculation, you're able to add a lot of value to your impact report. Okay, so I think we are done with the timing. It's very difficult for me to keep under the time limits, but I'm sure Vijay will agree that I have not really overshot my time this time. and I have finished in time. So yeah, I'm all okay for any questions and answers, or any questions, any doubts, or any clarifications, or any technical point that you may want to ask. We can do that now.
Yeah. Thank you, Rahul. Thank you for breaking down such a complex concept into very simple words and simple explanations and examples. So I think I'm sure the audience would have got the concept very well. So with that, let me open the Q&A. I think we already have 3 questions with us, 2 in Q&A, 1 in chat box. And if you still have some more, please do drop your questions in the Q&A box. While Q&A goes on, so I also launch a poll. Please take a few seconds and give your feedback, so that will help us a lot. So that let me go to the first question. This is asked by Kajal. Is there a duration, the project or program, to measure SROI?
Yeah, so I think that's what I had mentioned during the discussion, that it depends. Yeah, so measuring the SROI depends on what kind of indicators are there. Are they perpetual? Are they permanent? Or are they temporary? Or are they only, for the duration of the program? So depending on the kind of outcomes or the kind of project, I think you will have that. You will have to decide on the duration. But SROI will always be for a duration. So you'll always say that over a 5-year period, this is the social return on investment, or over a 10-year period, this is the social return on investment. Just like any return on investment is time bound and periodic, without mentioning, SROI is also like that.
Thank you, Rahul. We have another question, interesting question. Anonymous. In some CSR programs, we will get some number. For example, 25,590 people are benefited. But is it necessary to cross-check the number, or can we go with the existing number?
This is not the question related to SROI.
Yeah.
This is the question related to monitoring.
Yeah, if you could still answer, that would be great.
Okay, so this is see, this is the monitoring methodology. I don't know whether 26,000 people are benefited, whether you want to cross check it, or whether, I don't know the context. See, if you are a CSR program and I don't know, your name is anonymous attendee, that's something really funny. So anyhow, I'll answer the question. So that's the question of monitoring. SROI will not be able to answer, or SROI doesn't have the tool to cross check or ensure effective monitoring. No, it's not. That's a monitoring. You may want to, depending on how and where and how, you may want to have cross checking or sample survey in place to cross check. It's always good to cross check. If someone is reporting 26,000 people are benefited, I think it makes a lot of sense to do the cross check. Can we set the SROI at the beginning of the project? Yeah, that's a good question. So yes, you cannot set the SROI at the beginning of the project unless and until you have done the SROI, or you have an idea of SROI for that kind of a project. So let's say if you are, let's pick up any example. If program or a project A, basis on your past experiences of similar projects, that this is the SROI typically for this project. So in that case, you can set. So you say that, okay, I have done 3 projects, and all these 3 projects in education or in healthcare gives me this kind of SROI. So then you can set up the SROI at the beginning. But if you don't have that kind of experience, then it is difficult to set an SROI, because how will that set, or that benchmark that you will set, what is the basis for that? See, it's not an investment. It's not a typical investment that, no, I have money and then I want minimum 20% return. It's not that like that. These are development and impact projects. So my simple answer will be yes, if you have an idea or if you have a data which says that, okay, for this kind of a project, this is the SROI, yes, then you can set. Otherwise, not. Otherwise, you can estimate. You cannot set. You can estimate that, okay, with this kind of a project, this will be the intended or expected SROI.
Thank you, Rahul.
Yeah.
Before we have another question in the chat box, I'll read it out. Before that, I request the participants to just please participate in the poll. We have 6 responses, so few more people,
Okay.
if you could give the feedback, that would be great. So the next question we have is from Nirmal Jana. SROI could be included while doing impact assessment of a CSR program?
Is it a question or is it a suggestion?
It sounds like a question to me.
Yeah, it should be. Yeah, I think this is what we're talking about. The impact assessment, I think it should be done doing SROI.
Yeah, I think we have
CSR programs impact assessment should be done using an SROI because it's a more powerful and objective tool. Oh, we have one more question.
Yeah, one more question from Muralidhar Achita. Under water project, the value of inputs 2,95,454, whereas the total impact value is 22 lakhs, 2 crores 21 lakhs 94,494. What are the parameters calculated in the total impact value? Please explain.
Okay. So I think again it's an interesting question because it's about calculations. So when we talk about the inputs, so the input in terms of input cost of 2,95,000, it includes the cost of setting up the water purification plant, so the machinery, the building, the equipment, the initial training of the villagers, and the program team's cost of the implementing organization. So all of these are the input costs. So labor, material, time, equipment, machinery, big filters, big plant, pump, and everything. This is the input cost to set up this whole plant. Now the impact value of 2 crores is the sum total of, number one, the savings that villagers were able to have because of the less number of sick days. So villagers were now not impacting, or they were not spending a lot of money on the medicines and doctors. So this was the first saving for them. Second saving was because they were not falling sick frequently. They were not falling sick frequently. They were able to work more, and therefore there was an increase in their income levels. So this is the second impact value. So all of them, majority of them were, when we look at the data, majority of them were able to go for more number of days. I think there was a 10, 15, 20 days more. So this was the second impact. Then these were the two main impact. Then third impact was that there were some benefits because they were not traveling to hospitals. See, 1 or 2 days, the small illnesses they did not travel to out of villages. But for anything which was little more than the local doctors, they had to travel to hospitals, which resulted in a lot of expenses and a lot of sick days. So these were the 3-4 important indicators. And then I'm talking about the village, which was kind of a big village, so almost 1,000 people or 1,000 families or so. So that's why the impact is really big. I don't know, I mean, see, there is another impact that we saw. We had not anticipated it when we were measuring it. there was another impact that has happened because this water plant was an independent business unit in itself. So this water plant was not free for anyone. So the villagers were members of this plant, and villagers were buying water from this plant at 3 rupees for 20 liters. This is the model that we have now. Because of the consumption, because of the efficient operations, and because of the integrity and everything, the village or this water plant was able to retain all the money that was going out of the villages, either in the form of transportation to hospitals, or in the form of medicines from outside, or in the form of water, buying water from the outside vendors. So this was like, it impacted the village economy, because whatever money was earlier going outside was now available and given to the water plant in some ways. So water plant was able to kickstart other developmental activities in the village. Water plant was able to fund the road development. Water plant was able to fund the organization of cultural festivals. Water plant was able to fund school education. So this is the indirect impact, but in SROI we didn't estimate that, because that was not the intended outcome anyways.
Yeah, Rahul, we have one last question.
Yeah.
Before that, let me do two announcements. One is, if you have, we would be happy to hear your comments or feedback. Please feel free to drop in the chat box. The second one is, we'll distribute certificates. So if you have not used your full name, or if you have done any typos in the registration, so please drop in your name that you want on the certificate in the chat box, so we'll save it. So yeah, before closing, the last question: is SROI an indicator at the time of doing baseline survey?
Again, see, it can be an indicator. Indicator. What do you mean by indicator?
I think what I understand is, when we are going to do a baseline survey, we will set some parameters. These.
Yeah, but SROI cannot be a parameter that can be set unless and until, as I answered earlier, unless and until there is a very clear-cut data which indicates this will be the SROI for this kind of a project. But indicator is something different. It's not SROI is not an indicator at this thing.
Okay. Okay, Rahul, I think we already ran out of time. It's already 2:31. Okay. So let's close the session, and thank you so much for your time and sharing your knowledge with the audience participants. And thank you all of you for showing the interest, and thank you for joining us and showing the interest in the small business webinars. We keep conducting such webinars going forward, and we keep circulating the invitations. So please do join, and I look forward to seeing you, all of you, very soon. And thank you, Rahul. Thank you for being with us today.
Thank you. Thank you, everyone. Thank you so much.
Bye-bye. See you again. Bye.
Bye-bye.